Okay, so the recording is working. I need um, if anyone can volunteer, if because I can't always see who's in the lobby. So if anyone can admit the
I
people,
could
yeah,
do
the doc,
Salim.
yeah, please, yeah, thank you very much. Thank you very much. So I will leave it for you then. And then we can start the 3 minutes. Yeah, yeah, you can read, Dr. Isra.
Okay. Is that all, doctor? There is another page.
Yeah, no, no, that's all.
Okay. Okay.
You are still until January, so no need to give you a lot of, when you approach, when your exam is approached, don't worry, you will have 3 pages patient notes, okay?
You're right.
Okay.
Then she will fight with you like me.
Yeah, yeah. So we finished the 3 minutes, but because I know maybe you are not still in the mode of daily practice. So what first what you are using the 3 minutes for? Okay, and tell me what was going through your mind in these 3 minutes.
Okay, okay. So first of all, I basically wrote down about what I could ask because it seems
Mhm,
the main complaint is sweating. So I
mhm,
asked around, how long the sweating has been, whether it's on,
okay,
if it's on the hands or feet or what's the area of the body, whether it's one-sided, bilateral, and how frequent it has been, like how number of times per week, and
mhm,
then also about whether this sweating happens at night time as well, whether
mhm,
there is any weight loss, red flags I was thinking of, like weight loss, any appetite loss, whether it any
mhm,
fatigue related to it. And then I was thinking about, maybe she is also on an anxiety medication, which is
mhm,
sertraline. So,
mhm,
this was started 6 months ago.
Hmm?
Sertraline can sometimes cause the sweating as well. So whether
Yeah,
it is
that's true.
with the sertraline, like has she noticed that it is with the sertraline? How's her mental health like? How
Mm-hmm.
much her anxiety is controlled with this sertraline? And whether what else I had written? Any family history of sweating?
Mm-hmm.
So sweating problems, and then of course the eyes as to what's going on. Whether she is having any recreational drugs,
Yeah,
because
that's
sometimes that
excellent.
and alcohol can also
Yeah,
cause the
sure.
sweating.
Yeah.
So these things, and then management, I think it will really depend on what I think from the history is the cause. But like
Yeah.
if we are
Yeah.
thinking secondary causes to exclude them, we can also do some blood tests to check thyroid
Sure.
function,
Sure.
HbA1c, etc. as
Yeah.
well. Blood pressure, maybe it's good to check
Sure.
the blood pressure as well, because she's over 40 now, so she could have a
Yeah.
blood pressure issue that's causing her the sweating. So
Okay.
that was going on in her mind. And if she was like looking for treatment, then possibly
Sure.
first to go with conservative
Yeah.
measures like antiperspirants or things. If she has not tried that, tried if it's due to the medication, I think then maybe try reducing the dose or considering an alternative. And then what else I have written? Yeah, that's what I have written. I
Okay.
think I
Yeah,
want.
that's good. That's excellent, to be honest. But for me, additional to what you said, I will look at the name. Okay,
Hmm,
again, so today's is little bit, there could be the case is little bit, out of maybe context. Okay, so she is again, she is not a descent. Okay, so from where she is important. Does she came from a country that have a TB or not? Okay, so you need to
okay.
ask about TB. Okay, and
TB,
family TB.
HIV. Yes,
Yeah.
yes.
Second thing, she is a female and she is, approaching menopause. Is this is a menopausal symptom or not?
Mm,
Okay.
mm, mm,
So
mm,
yeah, sweating, yeah, for sure you can concentrate in the sweating, but don't forget that sweating can be presentation of other diseases.
mm,
Okay, and female above 40, 45, or or above 40 even, you want to consider in your differential that it might be having, her change. Maybe she is in the menopause.
mm,
Okay, especially she have mood swings and anxiety 6 month. Is this something happening there? We
mm,
don't know, but it's
mm.
something that you need to consider it in your differential. Okay.
Okay.
The other thing in the 3 minutes, you will think about the possible differential.
Mm,
Yeah, what would be your management? Okay, write this in the piece in the whiteboard, and then uh, before 20-30 seconds, talk to yourself and neutralize. Yeah, it can be
mm,
this can be the case, but again, I don't know. Maybe not. Maybe the story will change. So
mm.
yeah, you prepared, but don't be fixed. Okay, because if you
Okay.
become fixed and they try to push the
Mm,
patient towards what you are thinking only of, it will
mm,
be a doctor-centered, non-shared management, scenario, and most probably you will miss, a lot of the cues. This is one. And the other thing that you need also, if you feel anxious, you need to do some breathing technique, think positively. So yeah, this what how I will use the 3 minutes. Okay.
mm. Okay.
Yeah. Yeah.
Okay. That's
So I will start your 12-minute time and you can go ahead. Yeah.
Hi there.
This is
Hello. My
yeah.
name is Asra. I'm one of the doctors. Am I talking to Nuria Ahmed today?
Yeah, yeah, it's me, doctor. Thank you for
Okay.
calling.
And can I confirm that you're 46 years old?
Yeah, doctor, it's me. Thank you.
Okay. Can I ask you, how can I help you today?
Yeah, to be honest, doctor, I'm not sure, to be honest, doctor. It's have been a while now, but it's increasing. That at night time, I'm always feeling hot, flushed, and eyes, and sweaty. I don't know. The sweat is everywhere.
No.
Yeah,
Okay.
yeah,
Okay. I'm sure this might be a bit distressful for you. Can you
it
tell me
is.
how long this has been going on for?
Well, to be honest, it's now for nearly a year, but the last few months, started to affect me much, becoming more frequent, and even sometimes, when I'm sitting, even when I'm not sleeping, when I'm sitting, doing my work, and then, in the office, I
Mm,
will suddenly feel hot and flushed, and and everyone around me is fine. I am the only one who's feeling hot and flushed, so I'm not sure, to be honest, what to do,
Oh,
doctor.
okay. No, I'm sure we can help you around, but I do need to ask you some more questions just to narrow down what it could be.
Okay.
So, can you tell me a bit about your general health other than the sweating? How are you doing?
Oh, well, I'm fine, but what
Mm.
exactly you want to know? I'm
So,
pretty okay.
okay. Are you having any cough at all?
No, no, no cough at all.
Okay. And are you feeling that you have lost weight in any way in the last 6 months to 1 year since this has been happening?
No, doctor, not specifically. To be honest, I think I'm putting weight, and I'm finding it difficult to to lose weight. That's why, I joined the gym around the house, near the house, and I'm trying to go and, do exercise and lose weight. Yeah.
Mhm. You did mention to me that the sweating does happen at night time as well, and it can happen during the day as well. Have you noticed any particular, connection to any kind of food that you're eating or any activity that you're doing that increases the sweating?
No, no, not at all, doctor. To be honest,
Okay.
like, it's unpredictable, can happen at any time.
Mm-hmm. And does it happen in the whole body or any specific parts?
No, all my body, no specific part, to be honest. Yeah,
Okay. Other than this, are you having any skin problems like any dry skin or
yeah, hello?
hello? Yes.
Yeah.
Other than this, are you having any skin problems like any dry skin?
No, no, no.
Okay, that's fine. And you did mention that it's been happening for around a year. So, in this time, have you noticed any problems in passing a wee at all? Like any wee symptoms, any burning or stinging when passing a wee?
No, no, no.
Okay, okay. And do you mind me asking some personal questions? So, are you sexually active?
Yeah, doctor, yeah.
Okay. And has it ever been, just because this can be related, have you ever noticed that intercourse is more painful lately?
Yeah, yeah, doctor. Yeah, yeah.
Mm,
Yeah, this we noticed it. So even we become less intimate, doctor. Yeah, I
okay,
feel that I'm a little bit dry from down below, and we are bringing some gels, but still,
okay,
I don't feel I'm eager to do any,
okay.
yeah, yeah.
And because you've told me this, I might ask something else that might be connected. So,
Mhm.
uh, are you still on your periods, or have you finished having periods?
To be honest, doctor, I'm not having period for now 5 years since I
Mm,
have the coil. So
mm,
once they put the coil for me.
mm.
I think Myrina or Kyrina, something like that. And
Yes.
since then, I'm not getting periods. So,
Okay, fair enough. And you've not had any unusual bleeding since these 5 years since you've been on the Mirena,
no,
is that
no,
right?
no, not at all.
Okay, that is fine. And have you had any recent travel at all?
Just for visiting my parents. Yeah.
Okay, I would just like to ask you, I know that this might be a question that you might have to rub your memory for this, but have you had vaccinations growing up? Yeah, like
Vaccinate.
normal vaccinations that you have as a child?
Yeah, yeah, I have all the
Okay.
vaccination.
Okay, that is lovely to know. Sorry for asking so many questions. Sometimes it's the lifestyle factors as well that can impact on, what symptoms we are getting. So you did
Yeah.
mention your diet isn't great. What kind of foods are you eating?
Well, I'm eating everything that can, get my weight less. So I'm eating fruit, vegetables. I'm
Mm-hmm.
eating more meat than any, the carbohydrates. I'm decreasing it. So I'm more eating toward the keto diets more. It's not strictly keto diet, but more toward the keto diet, doctor.
And despite this, you mentioned you're still gaining weight. Am I right?
Yeah, despite this, I'm gaining weight,
Mm.
but I'm really, and even I feel some pain in my joints,
Okay.
yeah, and sometimes I'm feeling my muscle achy, but I'm
Okay.
not sure, yeah. Mm.
Okay. And do you drink? Do you smoke? Do you smoke?
No, doctor, I never smoke, doctor.
Okay. What about alcohol, if I may ask?
No, no, I'm not drinking alcohol at all, doctor, no.
Mhm.
Mm.
You mentioned you're with your husband.
Mhm.
Is there anyone else living with you at home?
Well, all my children now is grown up. No, they are, they have their own houses,
Mhm.
yeah.
And I see that, at job place as well, you mentioned that sometimes you feel sweaty. So how it is impacting your work? How are you feeling now?
But also, I'm not sure, doctor, if it's related, but sometimes I feel my brain is foggy. So I
Okay.
lose concentration, and even I came to you to your colleague 6 months ago because my husband started to notice that I'm more snappy,
No.
and we are more fighting with each other. So yeah.
Mhm. And I see 6 months ago when you came in, you were given sertraline, which is an anti-anxiety drug. Has that
Mhm.
helped you in any way with your mood swings and being snappy?
Well, yeah, it helped a lot, to be honest. Yeah, it stabilized my mood. Yeah.
Mm-hmm. And how are you coping in terms of your mood? Because I'm sure with these physical symptoms, it can impact people's mood as well. So how is that?
No, no, my mood is fine now.
Okay.
Everything, since I took the drug, everything is okay.
Mm-hmm. Okay, Nuria, based on what you've told me, the sweating that can happen at night time, the flushes that you're getting in the morning, your general aches and pains in the body, this might be suggesting that you might be going through the hormonal change, which is called as menopause. Did you have
Mhm.
any idea or had any thoughts that this could be that?
No, to be honest, no. I was not thinking. I thought maybe,
Mm-hmm.
any maybe the medication or maybe, I'm not. I was not sure, to be honest. I didn't treat it specifically, but
Mm-hmm.
yeah. So what you are suggesting, doctor, to do?
There are a few options that we could take, which are either, there can be non drug options and there can be medication options as well. But before that, I would like to ask you that hearing this about menopause, does this concern you in any way?
No, I think it's natural process. If I
Yes,
become
yes,
menopause, why I
absolutely.
should be concerned? No, I hear about the menopause, and now they are giving the hormones. So
Yes,
I
yes,
don't
yes.
think, yeah.
Okay, okay. And hearing about menopause, I know that there would be a few options we will discuss. But is there anything else that you were hoping for today apart from the sweating?
No, to be honest, no, doctor.
Okay, okay. So as I said, there are a few non-drug and drug options. So non-drug options are, it said that a lot of women who are going through this change, hormonal change,
Hmm.
can benefit from things like exercise, which you're already doing, but things
Hmm.
like stretching and yoga as well. Would you like to consider that at all?
Yeah, no problem. But this will help my sweating.
Uh, sweating. Okay, yes, that's a very good question. Now, for sweating in particular, as I said, there are hormone options, the medication options that can be taken as well. And these medications are hormones, which are basically a combination of estrogen and progesterone hormones, two kinds of hormones. I see
Hmm.
you are already on the coil, but it's been 5 years, so you might actually have run out.
Hmm.
So, if you are happy with the same, one option could be that we could replace the coil and we could give you an estrogen patch and on to put on your arm or leg that can be used twice a week, and that can help with your symptom control. How does that sound?
Oh, okay, that's fine. But so do you need to remove the coil, doctor?
So we need to remove the coil and replace it with another coil because you said it's been 5 years, so it's
Hmm.
actually runs off at the 5 years point.
Hmm.
Okay, okay, and just a few things that I would still like to tell you that women who are started on this hormone replacement therapy for the menopause, they can sometimes have some side effects as well from it, and this can be any unusual bleeding some women can experience or other symptoms, but they might not always be there. But things like, I don't mean to scare you, but we should tell anyone who is going on it. It's things like clots in the legs or lungs and small risk of breast cancer as well. Um, how do you feel after hearing this?
Well, if it will help my night sweats, that's fine. I don't care, to be honest, doctor.
Mhm.
I wanna get rid of these sweats.
Hmm, hmm. Okay, that is good to know. Now, if you would like to opt for this option, we can start it after bringing you in by doing a blood pressure check, because that would be good, just for your health check as well, to have a blood pressure check and to check your weight and height, just to make sure that you're okay, and then we can re-review things in 3 months' time, to see how your symptoms are improving with it. How does that sound to you?
Yeah, that's fine, doctor. I think, yeah, I would do that if you feel that will help, doctor.
If that hasn't worked for you, there is another option of another medication called as clonidine, but we can have a detailed discussion about it in our next appointment if things haven't worked out with this medication. How do you feel about it?
Yeah, would clonidine help the sweats?
Yes, it can help with the sweats as
Yeah,
well.
sure, sure, no problem, doctor. Yeah, that's fine. Okay, so how do you feel?
Oh my God, it was difficult to be honest,
No,
but I don't know. I thought
no,
I would.
no, yeah, yeah. Give me, tell me your reflection because the
Oh
reflection is
no.
important. Yeah, yeah. Tell me your reflection.
First of all, I think I spend at least a minute more in terms of data gathering, so I should have cut down on that. In terms of
Yeah, yeah.
management,
Your management is started at 4 minutes, so
mm,
it need to be started at 6 minutes. So,
mm,
well, I'll consider that this undifferentiated illness.
mm,
Usually, the data gathering will take time, so you may finish it at 7 minutes and make 5 minutes for the management.
mm.
Uh, so this is my reflection on your thoughts. So tell me more.
Okay, and then what else was there? Like I tried to first, like in the data gathering, I think I was okay, like because I tried to rule out other things as well apart
Yeah.
from the
Hmm.
menopause and things. But
Hmm.
then in the management bit, I felt that maybe I could have there were more things in my mind that I could offer her, like counseling as well and things, whether she's doing that already with her mood swings, what that suggested
Hmm.
to her
Hmm.
previously, and breathing techniques as you mentioned, but then
Hmm.
I ran out of time, so I couldn't discuss much about that
Yeah,
because I
this.
thought that I would have to mention the medication as well, given that she is having body aches and kind of holistic symptoms
Yeah.
of menopause. So
Yeah, well, I think you fill in the trick, okay? Because the problem is this case, in which basis you 100% sure that she is menopausal.
hmm, hmm,
Yeah, the problem these patient doesn't have periods. You will
hmm,
not be able to be
hmm,
100% sure is
hmm,
she menopausal or not. She doesn't
hmm,
have period 5 years because she having the coil, and then she's amenorrheic 5 years.
hmm,
So menopause mainly the main symptoms that the change in the period, and then the additional 9 symptoms of different
hmm,
organs in the body. So genitourinary, dry skin, and the other symptoms, joint pain, muscle pain, decreased libido. Well, she's showing most of them there, but then the main symptoms that we don't know, her bleeding is there or not. We don't know.
hmm,
So for me, it's very difficult this case to be 100% sure that
hmm,
it is a menopause. This is atypical, presentation of the menopause, which is she's not bleeding. Okay, so don't be 100% sure. Oh, you are menopausal, then we'll treat you with the menopause, and you start to treat the menopause.
hmm,
No, you'll say, okay, to be honest, yeah, there is a lot of possibility for your symptoms. Okay, but I would like, to do blood tests to exclude the possibilities. Okay, I want to do these full blood count. I want to do your thyroid function. Okay, one of the main differential, I will do the general check of your liver and kidneys, as well as I might consider doing your FSH. Okay, so such case you will never be able to diagnose the menopause without checking her hormones, because
hmm,
she already amenorrheic. Already she is taking the Mirena is making her amenorrheic. So you need a clue to tell you, oh, this is she have the menopause or not. You can then remove the other option. You will remove the Mirena and stay 1 or 2 months and see how a period will return or not. So,
Okay.
which is, I think, option that may make you lose a lot of, make you lose a lot of, if there is an underlying sinister cause or something,
Mm,
will make a delay in the diagnosis. So I
mm,
won't do that option. I would do for her FSH, twice, okay, 4 to 8 weeks apart, and make
mm,
sure if it's low or not.
But usually it's for 40 to 45, isn't it? But are we doing it because she's even
Uh,
46 and we don't know
no,
about
yeah,
it?
because she doesn't have
Mm,
period.
okay, fair enough.
Yeah, so this is the trick in the case. She
Mm,
doesn't have period. If she
mm,
have period, yeah, I will tell you, well, her period is irregular. Her
mm,
period now is becoming scanty, or it's coming every 2 months. Then you
mm,
don't need to do FSH, because most probably FSH will be misleading, because it will be, sometimes will be fine, sometimes will be not. That's why
mm.
you are avoiding it. But since
Okay.
she doesn't have menopause, you don't have a other clue except doing the FSH.
Hmm.
Okay.
Okay. I get it. Okay.
Yeah, so and then go then all that, and then after that you will do the blood, and then tell her, yeah, it might be most probably it's menopause, and then you might then go through the treatment of menopause. Okay, so this is the trick on it. So what is the possible causes, and which you already mentioned in the differential, in the data gathering. I don't have any problem with your data gathering, to be honest. It's completely, perfect. Okay, and you did mention a lot of differential there, so you are ticking the boxes of the differential, but then you need your management to be concise with your different with what you did up. So you did a great work up, but then by targeted to the menopause, and you still don't have the definite diagnosis of the menopause,
Hmm.
is a bit tricky. Okay.
Okay. Okay. I get
Yeah,
it.
and please always when a patient coming with history, of menopause, and you even pretty sure that that might be a menopause because her menses are stopped,
Hmm.
or her menses, irregular, just mention in between some differential. Okay, we might consider, doing for you thyroid function test, for example, okay, just to exclude any other causes that may give you the same symptoms. Okay.
Okay.
Yeah,
Okay.
so consider the other possible differential of menopause, and don't just be 100% sure. Yeah. So if she have irregularity in the menses, yeah, most probably you have menopause. I suggest that we will start for you this treatment. The treatment option, like you said, it's excellent what you said. Okay, but don't forget also, before giving the treatment option, you need to exclude the contraindication of HRT. Okay, as you said, blood pressure, history of breast cancer, or history of DVT, or thromboembolic syndromes,
Hmm.
as well as you will need the liver function, because if she have liver disease and she doesn't know, and her liver function is high, don't have any blood here, then
Hmm.
it will appear, for example, in the blood. So you will need the bloods even before starting the HRT, but
Okay.
you may say your option in the management plan. Okay.
Okay.
Yeah,
Okay.
is that clear?
Yes. Yes.
Just to run through what is the causes, of night sweats. Okay, so drenching at night can be lymphoma, but for sure, if there is no problem in the full blood count, this will exclude lymphoma or leukemia. And then infection, endocrinal problem, connective tissue disease, and don't forget for sure SSRI and anxiety, and menopause. So these consider to be the differential as well as for menopause. So you can go through some of these questioning during your data gathering as you did. uh, History of travel. Also, when I told you that I'm traveling to my parents, then you didn't say where they are. It's important just to see if they are come, if she's traveling to areas where there is TB predominance, okay, or any infectious disease. That's don't ignore it. Otherwise, they will mark it down in the active listening. It's just also when you ask about vaccination, I didn't get it. Are you asking the vaccination for the TB, isn't it? You are asking for the BCG, isn't it, Dr. Isra?
Yes. I meant
Yeah,
BCG. Yes.
yeah,
Yes.
BCG. Okay, yeah. That's I thought. Yeah, that's fine. Well, there's other way to ask about BCG, isn't it? Because we don't know. You don't know also that if the patient coming from an area that they are giving her BCG or not. So
Hmm.
to ask her about the scar. Do you have a scar at your
Okay.
shoulder or not? Yeah.
Okay.
Okay, most of us have the scar that is in deltoid, so just ask her about the scar. Okay,
Okay.
and these are the general blood that we might consider any patient having, menopause
Hmm.
or night sweats. If the patient told you there is lumps and bumps and this, then you will, according to the symptoms, you will refer if it's needed. Okay. So mainly this case coming for differential diagnosis, okay, undifferentiated illness, which again, undifferentiated illness is a tricky. So you need to consider, if the patient is coming with the vague symptoms and you don't have a clue of the possible diagnosis or a sure sign of the possible, of the possible diagnosis, you need to say differential. You need to say this, there is a lot of causes can cause that, this and this and that. Okay. But in your case, I think the most probable thing is menopause. Like, to be pretty sure and 100%, I would like to do some blood tests for you, then mention the blood test. However, if it's menopause, then the following is the choices of treatment. I like choices, the word choices, rather than options. Okay, because
Okay.
choices is giving the part, and the choices, I think there is more, it's more powerful of freedom for the patient to choose. Okay, so rather than options, because option is always limited, but the choices is more liberal. So
Okay.
I like the word choice rather than option. Okay.
Okay.
Um, Again, these are the differentials of menopause, especially if atypical presentation of menopause. Okay, an anxiety disorder, alcohol-induced symptoms, endocrine, metabolic syndromes, tumor, TBs, and drug-induced symptoms of menopause. Um, and as you said that FSH, we are not using it except if there is a doubt. Okay, so if the patient is less than 45 and started to have a problem with her menses, then you can do the FSH. Or if the patient is amenorrheic and above 50 and you want to know shall we stop the contraindication or not, then you can do the FSH and see how it is. And the third one that should be written here, if the patient doesn't have menses due to coils, okay, then you need to confirm that by the FSH. Um, the effect of contraception on FSH, does anyone know what are the effect of contraception in FSH?
It
So,
can
for
make it
example,
lower, I think.
sorry?
It can make it lower by a negative feedback, isn't it?
Yeah,
Like it can
exactly,
make the effect
exactly.
low.
So cases that, for example, have combined oral contraceptive pills, okay, and they don't have menses on the, for example, if they are doing continuous, continuous cycling. So yeah, then you need to stop the tablet if you are considering, to doing FSH for such cases. So sometimes even if they stop, for example, the contraceptive, the oral contraception, and they didn't get withdrawal bleed for any reason, and then you are not sure as to she's menopause or there's a problem with her endometrium because that's why she doesn't get the bleed, then you would do the FSH after stop it the combined oral by 6 weeks, because the estrogen is the one who's responsible for the negative feedback of the FSH, not the progesterone. So if the patient on progesterone only, okay, you can do the FSH. It will not be affected by the progesterone tablet, the mini pills, or even the Mirena, okay? But it will be affected if the patient is taking Depo-Provera, okay? Because the Depo-Provera is high concentration of progesterone, so it will still have negative feedback. Okay, is that clear?
Okay, okay, thank you.
Okay, okay, strong okay or half a strong okay? Because your okay is not, doesn't make me feel that I'm
Uh,
clear.
I
Thank you,
think
Salim.
if you
That's
can
very good information.
repeat, please repeat. Thank you.
Yeah, repeat. Okay, so the only contraception that can affect the FSH level is the estrogen containing contraception, okay? Contraceptive pills, or even the estrogen containing combined, HRT. So if you are giving, if the patient is taking estrogen by any way, and you are eager to do FSH for them, you need to stop the estrogen component or the tablet that contain estrogen for 6 weeks before doing the bloods, okay, which is written here. So 6 weeks prior taking the bloods.
Okay.
Okay, any progesterone containing medication will not affect the FSH level except if it's Depo-Provera. So Depo-Provera will affect the FSH level because the Depo-Provera have, a high level or high concentration of the progesterone. So it will be able to, to do a negative feedback on the pituitary. Okay, other than that, nothing, nothing from the contraception that containing progesterone only would affect the FSH except the Depo-Provera. Is that clear?
Yes,
Yeah.
Yes.
yes,
Yeah,
doctor.
and that's why with the Depo-Provera, if you will do FSH, it will be, when the next injection is due. Okay.
Okay.
Yeah. Sure. Sure. Any question in this case? No. So it's clear. Hopefully. Yeah. Please.
Yes, it was very clear.
Yes, yes, yes.
Menopause. Yeah. Please. Menopause. Always consider differential. Always